Muy buenas tardes, tengan todos ustedes. Soy el doctor Eduardo Antonio Lara Pérez. A nombre de la Fraternidad Médica por la Salud, Médicos Unidos por México y el Colegio de Médicos del Estado de Veracruz, les doy la más cordial bienvenida este viernes 19 de septiembre del año 2025. El día de hoy tenemos un invitado muy especial y es un honor para mí el presentar al doctor Paul B. Williams, que nos va a hablar acerca del cambio climático te dejará sin aliento. El doctor Williams es originario del estado de Washington. Estudió medicina en la Escuela de Medicina de la Universidad de Washington. Realizó la especialidad de pediatría en el Centro Médico de la Universidad Rochester en Nueva York. Hizo la subespecialidad de alergia e inmunología que terminó en la Universidad de Washington. De ahí se unió al Centro de Alergia e Inmunología del Noreste en Seattle. Y si vamos por décadas, de la década de los 90 al 2000, participó como investigador principal en el programa del manejo del asma en niños. Ha publicado múltiples estudios científicos, casi la mayoría tratándose de problemas de asma y alergias. También se convirtió en profesor clínico del Departamento de Pediatría en la Universidad de Washington. En 2009 recibió el reconocimiento Jerome Bliss de la sección de alergia e inmunología de la Academia Americana de Pediatría. En 2010 fue reconocido como profesor del año en alergia por la Sociedad Americana de Alergia e Inmunología. También en 2014 recibió otro premio acerca del profesor voluntario destacado. Fue en varias ocasiones el top doctor en Seattle de 2016 a 2018. En el 2021 se retira de la práctica clínica activa después de 30 años de servicio y se le nombra médico emérito. En el 2022 fue secretario de la Sociedad Americana de Alergia e Inmunología. En 2023 publicó varios artículos sobre asma, inmunología, y además frente a la pandemia del COVID-19, tuvo una respuesta muy importante en el trabajo que se hizo la Sociedad de Alergia e Inmunología. Recientemente acaba de dejar la presidencia de la Academia Americana de Asma, Alergia e Inmunología 2024-2025 y ha tenido varios reconocimientos: premio al alergólogo y docente del año, premio al profesor clínico y voluntario destacado. En su vida personal ha destacado en su comunidad por tener una gran actitud de servicio, resiliencia y empatía. Incluso ha sido comisionado voluntario de bomberos en su comunidad. Es un honor para nosotros contar con la presencia del doctor Paul Williams. Bienvenido, los micrófonos son suyos. Adelante, Paul.
Thank you very much, Dr. Lara Perez, for that wonderful introduction. Just one thing I want to say is that Washington University is actually in St. Louis. I actually got my training and am on the faculty of the University of Washington. So it's not much of a difference, but it is a little bit of a slight difference. Okay, so today's topic is going to be climate change. It will take your breath away. And our objectives this evening are to understand the impacts of climate change on the ecosystem and respiratory disease, to be aware of vulnerable populations, to develop plans to manage exposures to pollutants, and advocate for climate responsibility. Climate change is due largely to rising global temperature and increased CO2 in the environment, which has an impact on indoor allergens, pollen, and air pollution. So the increased frequency of severe weather events as a result of climate change leads to flooding and property damage with displacement, increased mold growth, and increased dust mite burden, which leads to exacerbation of existing allergic disease and perhaps greater risk of developing allergic disease. Primarily due to the increase in CO2 in the environment, we have longer pollen seasons, increased pollen production, and greater allergen potency, all of which result from a direct effect of the increased CO2 on the plant, but rising global temperatures have led to shifting geography of allergenic plant growth and longer pollen seasons, and that too exacerbates existing allergic disease and questionably increases the risk of developing allergic disease. Most of my talk today is going to be focused on air pollution, and that's due to increased burning of fossil fuels for cooling because of the rising global temperature. Directly, this increased heat causes acceleration of ground level ozone formation and leads to the increased risk of wildfires and particulate matter associated with those wildfires and subsequent deteriorating air quality. This clearly leads to an exacerbation of existing allergic disease. And also there's good evidence that it does indeed lead to a greater risk of developing allergic disease. So who's responsible for all these cumulative carbon dioxide emissions? And this is a pie chart that looks over the last 270 years of cumulative carbon dioxide emissions. And the United States, Europe, China, and Asia are probably responsible for 75% of those carbon dioxide emissions. But Latin America and the Caribbean, only 4%. So even though you only produce 4% of the carbon emissions, you suffer from the effect of all the other emissions. So we're going to start by talking about climate change. And what is climate change? Well, it's temperature extremes, so you have heat and you have cold. It's weather disasters, tornadoes, floods, hurricanes, cyclones, heavy rainfall, and also wildfires. So the increased temperature and drought conditions lead to those fires and increase the risk and frequency of fires. So temperature extremes include heat, and heat has direct effects on the respiratory epithelium and skin. It leads to increased level of ground level ozone. It has the effect on the pollens that we've already talked about, and also is associated with mortality. It also has indirect effects in that it leads to these weather disasters and wildfires, which go on to cause additional problems that we'll discuss a little bit later. And then there's also cold, and cold has its own direct effects on the airway, skin, and mortality. And actually, airway mortality or mortality from temperature extremes is greater with cold than it is with heat. This is a graph showing the global ocean and land temperatures over the last couple of hundred years. And you can see that these temperatures have been rising since pretty much the 1960s. And this is data from the National Oceanic and Atmospheric Administration in the United States. And additional data shows that the frequency of heat waves, the duration of heat waves, and the intensity of heat waves have also been steadily increasing since the 1960s. And the length of the annual heat wave season has also been increasing. So moving to weather disasters. So those are an indirect effect of excessive heat. They include heavy rains and floods, which leads to indoor mold contamination and also increased airborne pollen levels due to fractionation from the precipitation. Thunderstorms increase airborne pollens in a similar manner, but also are associated with increased amounts of fungi in the environment and in the air. And tornadoes and dust storms increase particulates, but also spread soil bacteria and fungi. So dust storms are a common occurrence in the southwestern states in the US. And this was a study from JAMA Network Open in 2025 that showed that there is the increased risk of ED visits for asthma following these dust storms.
Bien.
Now, I'm going to focus a little more on wildfires because there was an interesting paper in Nature from the last couple of weeks that indicated that wildfires and the pollutants that result from wildfires are leading to increasing amounts of all-cause mortality in the United States, and they predict it will be the leading cause of all-cause mortality in the US by the middle of this century. So let's look at some statistics. First, in the United States, the National Interagency Coordinating Center is responsible for keeping track of wildfire statistics. And in 2024, there were 65,000 wildfires in the US in 2024 and burned 3.6 million hectares. In Canada in 2025, so this year, which these fires are ongoing, they've had 4,400 fires as of mid-August. But even though they're less fires than the US, they're much larger fires, and they've burned 7.3 million hectares. So 2023 was a bellwether year for Canadian wildfires, and they had an increase in probably 7 times the number of acres burned compared to the previous 10 years. And those wildfires had an impact that were thousands of miles away. And this is a photograph of the air in Baltimore, Maryland in June of 2023 as a result of the Canadian wildfires, even though they're thousands of miles away from those wildfires. And this is the level of particulate matter concentration in the air at that time. And the EPA, the Environmental Protection Agency for the US, considers 24-hour level of 35 micrograms per cubic meter as being the upper limits of allowed particulate matter. And you can see that on those 2 days, it was up to 3 times that level. And the smoke was incredible. You can see that the smoke covered almost all of North America, with significant smoke covering a broad swath of the United States, including Baltimore City. And you can see that Mexico and parts of Central America were also affected, even though the fires were thousands of miles away. So we've been seeing similar things in California, where we're seeing more large wildfires. So the number of fires varies from year to year, but the trend on size of fires has been increasing over the last 10 years. And an interesting phenomenon is that we're seeing increasing global human exposure to wildland fires despite declining burned areas. So even in North America, though we have increasing burned areas, overall in the world, primarily driven by what's going on in Africa, the cumulative burned area is declining, but the human exposure is increasing. And the reason for that is that human settlements and the urban developments are encroaching on the wildlands. And so when they burn, there are more people that are exposed to the pollutants. And in Mexico in 2024, there were 8,000 wildfires that burned 1.67 million hectares. So even though a lot less wildfires than we've had in the United States, it was a 60% increase over 2023. So wildfires are important and very important sources of air pollutants. So let's talk a little bit now about the air pollutants themselves. So first of all, there's ground level ozone, and that's considered a secondary or transported pollutant. And it takes a combination of sunlight, volatile organic compounds or VOCs, and oxides of nitrogen plus carbon monoxide to produce ozone. So typically you'll see higher levels of ozone in areas perhaps a little bit distant from the urban population because it takes some time to develop. Particulate matter is probably the most important pollutant with respect to respiratory disease and skin disease and wildfires. And this is a combination of solid and or liquid particles that can carry a variety of substances, including heavy metals, PAH, which is polycyclic aromatic hydrocarbons, allergens, bacteria, fungi, the volatile organic compounds, as well as bioaerosols. The deposition of these particulate matter depends on the size. So we have sort of three categories of particulate matter. We have coarse particulate matter, which is 10 microns, between 2.5 and 10 microns in diameter. Because of its size, it impacts primarily on the upper airways and the skin. And then we have fine particulate matter, PM 2.5, which is 2.5 microns or less. And that will get into the lower airways all the way to the alveoli. And then we have particulate matter less than 0.1 microns, or perhaps ultrafine particulate matter that may be the most important and gets into the systemic circulation, but it's not as well studied as PM 2.5 and has been difficult to monitor. So this is a size comparison. This cartoon kind of gives you a feeling for what size these particles are. So we've got fine beach sand, for example, is 90 microns in diameter. The human hair is 50 to 70 microns. So again, PM10 or coarse PM is less than 10 microns. And PM 2.5, you can see these little tiny particles. That's why they get into the airways. So other air pollutants include oxides of nitrogen, with nitrogen dioxide being probably the most important. And it comes from fossil fuel combustion, but can be produced indoors as well as outdoors. There's carbon monoxide that is also a component that occurs from fossil fuels. Sulfur dioxide is also a fossil fuel pollutant, but it's more of a point pollutant. It tends to be concentrated around power plants and industrial facilities that are burning fossil fuels. And we don't think of this very often, but lead and other heavy metals can also be considered air pollutants. And actually in the LA fires from 2025, Los Angeles, there's a fair amount of lead measured in the air. There's also TRAP, or traffic-related air pollution, and that's related to traffic, obviously. And it's a mixture of particulate matter, or PM 2.5, nitrogen dioxide, black carbon, and what are called diesel exhaust particles. And diesel exhaust particles are interesting because they can actually promote de novo synthesis of IgE to allergens even without prior sensitization. And then there are the volatile organic compounds that we'll refer to as VOCs. And these are chemicals in the air with variable volatility and include such chemicals as benzenes, toluene, phthalates, and isocyanates. And then the polycyclic aromatic hydrocarbons, which can penetrate into the systemic circulation and actually impact the cytochrome P450 enzyme systems so they can have adverse impact on drug metabolism. So indoor air pollutants are important because adults spend 90% of their time indoors. Generally, indoor air pollutants are a complex mixture of pollutants that are determined by the local ambient air pollution, the amount of that air pollution that infiltrates into the home or the workplace, and indoor sources. So indoor sources include combustion products that come from cooking, heating, or tobacco use, but also building materials and furnishings, household cleaners or personal care products, and in-home activities, hobbies, or even in-office activities and the equipment in offices. So the local ambient air pollution and its degree of infiltration, as well as indoor sources, are dependent on what we call the built environment, or the structure of your home and its surrounding environment. So indoor air pollutants include PM 2.5. There are a multitude of indoor sources of that, and there's also the outdoor sources that can infiltrate indoor spaces. There's nitrogen dioxide, and that comes from high temperature combustion from gas and kerosene appliances. And there's ozone, most of which comes from outdoors. But if you have air purifiers or laser printers or disinfecting devices in your home or office, then that can also produce additional ozone. VOCs, or volatile organic compounds, as I mentioned, are a variety of chemicals. Here's some others that are listed, but in the home, you have acetone, plasticizers, and fire retardants on furniture. They're components of products that are used in the construction of homes, furniture, flooring, and carpet. They also can be produced by tobacco smoke, cleaning products, air fresheners, and gas appliances. And volatile organic compounds indoors are 2 to 10-fold higher than they are outdoors. And indoor air pollutants are often mixtures. For example, tobacco smoke is a mixture of particulate matter, aerosols, and gases. Cooking with gas stoves, the combustion associated increases the levels of particulate matter, ozone, and nitrogen dioxide. And particulate matter, particularly when you're frying foods, increases. And then if there's biomass smoke or wood burning appliances, you'll get a mixture of particulate matter, nitrogen dioxide, volatile organic compounds, and the polyaromatic hydrocarbons. And recently, radon has been classified as an indoor air pollutant. So moving back into wildfires, I want to talk a little bit about the chemistry of fires at the wildland-urban interface. And when you talk about wildfires, you're really talking about 3 different types of smoke. And the pollutants produced from wildfires really depends on what's burning, where it's burning, what the temperature is, the wind, and so forth. But first of all, you have the wood smoke. So smoke that comes from burning of wood or trees. And that produces black carbon, organic carbonation species. And then you have biomass burning, which is burning of the floor of the forest. So you have leaves and moss and grass and small bushes. And that leads to the production of increased levels of nitrogen and sulfur, as well as black carbon, but also inorganic chemicals, and interestingly, bacteria and fungi. And those bacteria can be in significant concentration. And then I'd like to talk about wildland-urban interface smoke, and that's what's causing increasing concern. And this is a picture of the LA wildfires from earlier this year. And this is biomass burning plus everything in the urban environment. So homes, autos, and electrical infrastructure. And as we'll cover, the pollutants from wildland urban interface smoke are probably some of the worst pollutants that we can be exposed to and responsible for significant increases in morbidity and mortality. So this is a drawing of a house. And when you think of the house, maybe you don't think of everything that goes into building a house, but of course, mostly wood and structure, at least in the US. But the contents, there's a lot of plastic and fabrics. And the other thing that we don't think about is that oftentimes there are vehicles in the driveway, in the garage, on the street, and they're mostly plastic, rubber, and fuel. And these are materials that are used in buildings, and these are the fire emissions that come from those burning buildings. So you can see that it's a variety of volatile organic compounds, carbon monoxide, oxides of nitrogen, cyanide, isocyanates, just a lot of really toxic air pollutants. And in the cars, you've got all these components in the cars. And again, quite a variety of toxic pollutants that are produced when those cars burn. And we talked about heavy metals in the air. A lot of those come from cars, and you can see the lead that's in the air in milligrams per kilogram from burning cars. And this was what led to high levels of lead in the air from those LA wildfires. And then volatile organic compounds, these are actually measured in wood fire or wildland urban interface smoke that's collected by planes in the atmosphere. And these are the variety of volatile organic compounds, including formaldehyde and methanol. And as I mentioned, benzene. And many of these are actually carcinogens. So let's jump now to vulnerable populations. So who are the people that we need to identify as at-risk populations? Well, children, the elderly, pregnant women, wildland firefighters for obvious reasons, but also people who work in agriculture or construction because they're working outdoors and exposed to outdoor air. The unhoused for similar reasons. People certainly with pre-existing disease are more vulnerable. And there's an interesting relationship between obesity and nitrogen dioxide. It has an impact on pulmonary function that you don't see in people who are not obese. This slide may be a little bit difficult to read for you, but it talks about susceptibility factors in fetuses, infants, and children and why they are more at risk. Well, they have longer exposures over their lifetime. They spend more time outdoors. For body size, they have increased air and water intake. They also have developing organs, poor thermoregulation under extreme heat conditions, more permeable skin and blood-brain barrier, and less effective nasal filtration. And then there are additional conditions that may impair their ability to adapt. So worsening nutrition and increased food scarcity, and inadequate access to healthcare during development, and a lot of times displacement in extreme weather conditions that exacerbate all of these things. So as a result, you've got fetus, infant, and child health effects that include allergic disease, dermatologic disease, and respiratory disease, in addition to many of these other disorders. And focusing again on the socioeconomically disadvantaged, at least in the United States. So we have problems with consequences of systemic racism, or social determinants of health, we call it. And that they often live in substandard housing that is closer to roadways and lack of green space. It's also closer to industrial pollutants. There's income instability that plays a role, as well as limited healthcare access. Because of where they live, they're exposed to more extreme heat because they have a lack of green space. Flooding is more of a problem, as well as exposure to extreme weather. As a result, they have magnified exposure to mold, pollen, air pollution, and wildfire smoke, which increases atopic disease and asthma burden. So what are the mechanisms by which these pollutants cause disease? Well, the primary thing that causes disease due to pollutants is disruption of the epithelial barrier. So heat has direct effect on the desmosomes and adherent junctions of epithelial cells. And then the particulate matter, industrial pollution, and wildfire smoke causes additional damage. So you have receptors such as TRPV4 and TRPV1 on the epithelium and the sensory neurons. Those recognize these products as alarmins and result in increased secretory phase with increased mucus, increased cytokines and chemokines that promote a type 2 epithelial response. You have damaged cilia and epithelial shedding, which increases the paracellular permeability and subsequent inflammatory response. So additional impacts of these pollutants are that ozone and nitrogen dioxide can actually modify the chemical characteristics of airborne pollens and make them more allergenic. They're synergistic with high temperatures and other pollutants to create increased problems. Nitrogen dioxide can penetrate deeply into the lung, and both are associated with increased mortality. Particulate matter, particularly PM 2.5 and its constituents, have unique effects because what is carried on these particles depends on where they're produced. And so you can have a variety of different types of particles depending on the source of the pollution. But wildfire PM 2.5 is worse than non-wildfire, worse than indoors, which is worse than outdoors. Prenatal exposure to particulate matter can have epigenetic effects as well. Volatile organic compounds can induce upregulate other epithelial receptors, leading to an adjuvant type response in allergic disease to TSLP and TRPA1. You get increased Th2 cytokines, also transepidermal water loss. They can enhance cutaneous sensitization, and they activate the aryl hydrogen receptors, which can influence gene expression, particularly to increase the expression of pro-inflammatory genes. So what are the clinical or symptomatic effects of pollutants? Well, climate change in and of itself has an effect. So heat stress directly can decrease pulmonary function and increase airway hyperresponsiveness and lead to asthma exacerbations just from the heat. Weather disasters are also associated with asthma exacerbations, such as thunderstorm asthma and loss of control, and also decreased pulmonary function. Wildfire smoke has been associated with a decreased response to viral infection, so a limited immune response, and also increased asthma symptoms and exacerbation. And tornadoes and dust storms increase asthma symptoms and are associated with increased mortality. Now, individual pollutants such as ozone can interact with heat to lead to higher mortality, but it also has a direct impact on the airways with irritation leading to cough, mucus production, bronchial hyperresponsiveness, and inflammation. It's associated with a decline in pulmonary function in adults, a decrease in lung growth in children, and can interact with other pollutants with complex effects, particularly the volatile organic compounds. Nitrogen dioxide is associated with a loss of asthma control, new onset asthma, a decline in pulmonary function tests, and increased sensitization to allergens, but can also have an adverse impact on neonatal lung development that we'll expand on a little bit later. The impact of nitrogen dioxide is worse if there's pre-existing asthma or particularly in former smokers. Particulate matter and its constituents can reduce pulmonary function as well, more so in former smokers, increase asthma symptoms and emergency department visits, hospitalizations and mortality, increase the risk of asthma, and lead to more respiratory infections. Volatile organic compounds contribute to airway remodeling, exacerbate inflammation and asthma morbidity, and can even alter T cell populations when they enter the systemic circulation, and a potential adjuvant in those with allergic asthma. As we mentioned, that can sometimes be associated with changes in pollens. And radon, as I mentioned, is considered now an indoor air pollutant and has been associated with decreased asthma control in children. So the American Thoracic Society over the last few years has been developing reports called Health of the Air that cover 2-year segments. And they started this in 2015. And this article is from the 2018 to 2020 Health of the Air report. And it talks about not only outdoor air pollution, but now are starting to include wildland fire. And what they do is they calculate the preventable national annual health impacts from these pollutants that are anything greater than what their recommendations are for maximum tolerable levels. So you can see that PM 2.5 is associated with a median of all-cause mortality of up to 20,000, but respiratory, hospital admissions, and ED visits, new onset asthma that could impact as many as 200,000 people, and asthma symptoms in millions of people. Ozone above their levels is associated with respiratory mortality, also emergency room visits and hospitalizations for respiratory problems, new onset asthma, and increase in asthma symptoms involving millions of patients. Now, if you just look at wildland fire particulate matter, it also is associated with all-cause mortality, respiratory emergency room visits and hospital admissions, as well as new onset asthma and asthma symptoms. And ozone from wildland fires are a cause of respiratory mortality, as well as the other things that we've talked about. So as I mentioned, the pollutants associated with wildland fires, ozone and particulate matter, are becoming an increasing burden for those in the US and an increasing cause of mortality and morbidity. So this is going back to the Canadian wildfires in 2023. And what you have here is a graph of different conditions in the state in general, and then also other parts of the state, where the blue line is the daily mean particulate matter level, and the dotted line in these individual regions represents the baseline. So you can see that during those fires, the mean PM 2.5 levels were much higher than the baseline. And you can see these blue bars, which represent the number of asthma ED visits, nicely associated with peaks in particulate matter. And in Europe, the European Academy did a systematic review for their guidelines on environmental science for allergic diseases and asthma. And in the studies that they collected, you can also see risks, increased risks for ED visits from PM 2.5 and ozone. And what's interesting is that there's a lag time from time of exposure, with the highest effect for PM 2.5 3 days after exposure, and similarly for ozone. And then if you look at hospital admissions, PM 10 or coarse particulate matter is associated with an increased risk, as well as nitrogen dioxide and ozone. And we talked about new onset asthma and the epigenetic changes that can occur from exposure to pollutants. But this is a study in 2024 that looked at early life exposure to air pollution and childhood asthma. And what they found was that the risk of asthma incidence and the odds of asthma from exposure early in life to nitrogen dioxide and PM 2.5 were increased at 4 years of age and 11 years of age. So early exposure has an impact on the development of asthma at a later age. And they found that the risk was higher among minority families living in urban communities. They're with characteristics that we talked about earlier for socially disadvantaged populations. And so it's important to improve air pollution regulation if we really want to reduce asthma risk. And in another study looking specifically at ozone in combination with other pollutants, particularly particulate matter, there was also an increased risk of asthma at 4 to 6 years of age. So early life exposure is important. And this was a relatively low ambient ozone exposure. This is a study that looked at oil and gas development, and they talked about the life cycle stages and its contribution to pollutants. So they divided the development or oil and gas production into upstream and midstream life cycle. So that involves exploration and extraction, storage and transport, And then there's downstream effects of oil refining and gas processing, and then end use, primarily consumption of the petroleum. And you can see that the upstream, the exploration, extraction, and storage and transport are associated with the production of gases such as methane, formaldehyde, and acetaldehyde. And these percentages are actually a percentage of the total emissions for the continental US in 2017. So just the oil and gas production leads to significant amounts of pollutants. There aren't much effects from the downstream life cycle, but end-use consumption is clearly the worst, with carbon monoxide, nitrogen oxides, and many gases, and also particulate matter such as organic carbon and black carbon. And they looked at, in the same study, the health burden of ambient air pollution linked to the oil and gas life cycle stages. And this is divided up by states, with the states that were most impacted were the ones that are most involved in oil and gas production. And you can see that there was an increase in premature mortality, impacting 91,000 cases per year, preterm birth of 10,350 cases per year, asthma incidence 216,000 cases per year, and life cycle cancer incidence of 1,600 per year. And this graph will show you that virtually all of these health burdens are associated with the end use of the petroleum products. And what about the national, global, and regional mortality burden attributable to air pollution? Well, this is a study that looked at associated mortality rates around the world, and you can see that per 100,000 residents, there are increase in respiratory AMRs throughout the world, but the global south, particularly Africa and parts of South America and Indonesia, are most impacted. So it's a worldwide problem. So what can we as allergists do about this? Well, first of all, we can try to mitigate the problem. And that means try and reduce the pollutants that are produced. Nationally, we can advocate for change in policies that impact climate change. Locally, you can promote climate resiliency, so cooling centers for those people that don't have air conditioning, and air filtration systems in the home and at work, at schools. Increase social contact within neighborhoods, so neighbors taking care of neighbors, and urban green spaces to reduce the heat effect and the carbon dioxide level. And in your practice, even consider developing greener practices and greener health systems with less reliance on fossil fuel products produced from fossil fuels, and also fossil fuels used for heating and air conditioning. And when we can't mitigate, then we have to look at adaptation. And adaptation primarily involves education. You have to educate your patients, you have to educate your staff on the importance of air quality and its impact on respiratory disease, and maximize disease management. I like to say you need to improve your environmental and social histories. It's important to know where your patient spends time. So for example, children spend time at school. So what's the structure of the school? Is it an older school? How much time do they spend outdoors? What sort of occupations do the adults have? What are they exposed to in their occupations? What about the home? What about the neighborhood? All of these things are important. Do people have access to medical care? Are they close to sources of pollutants? And all of this is so you can identify patients that are at risk and deal with that. So here's an example of some tips to protect people with asthma and allergies from wildfire smoke. So it's important they keep medications on hand during the wildfire season, or even in areas that have poor outdoor quality for other reasons, such as traffic-related air pollutants. You may want to change their controller medications or their inhaled corticosteroid doses during those periods of time. So you want to have wildfire smoke and air pollution events sort of listed on the asthma action plan along with other asthma triggers. In the house, you can try and create a cleaner airspace using MERV 13 filters if you can put them in your air conditioner or heating system. If that's not possible, or maybe in addition to, you can use portable air cleaners in the home or in the school or in the office. But it's important that these are air cleaners with a mechanical HEPA filter and not an ionizer, because ionizer air cleaners produce ozone. And if you can't afford a portable air cleaner, there are ways to sort of build your own using a combination of a MERV 13 filter and a box fan. And you want to advise your patients to limit time outdoors, but if they have to be outside, they should wear a NIOSH certified N95 or equivalent mask. The paper mask and dust masks are not effective at reducing exposure to air pollutants. This is a little cartoon showing you how you can make those DIY or do-it-yourself air cleaner designs. So you can use anywhere from 1 to 5 filters. The more filters, the more effective it is. But these are all ways to sort of make your own air filter. And this is a study that looks specifically at using air filters in multi-settings, so home and school and children. And you can see that there's a definite benefit with an absolute increase in pulmonary function parameters in those that were using air purification compared to those not using it. And speaking of schools, I think it's important, excuse me, for physicians to deal with schools and outdoor activities. Many times the schools aren't thinking about outdoor air quality and how that impacts the students. So this is one of many different types of graphs that have been developed by the Environmental Protection Agency in the US. And so you have green is good, purple is very unhealthy, and you have different ways of dealing with that with respect to the type of outdoor activities. You may need to tell your students with asthma on their asthma action plan that maybe they need to stay indoors when air quality is unhealthy for sensitive groups or worse. And then finally, I've got some resources for you to learn about air quality, to find handouts for your patients about air quality. Particularly useful is in the US, and you may be able to use it yourself, although it may not be accurate for your location, but airnow.gov, you can plug in your zip code in the US and get air quality and the air quality monitors in your area. But there are educational resources that are available at that website, and there are fact sheets for patients on indoor air quality. There are resources specifically for wildfire smoke. Again, EPA and fireairnow.gov, and a video on how to build that do-it-yourself air cleaner. And this is an example of one of those. You can also get handouts on extreme heat and indoor air quality in multiple languages from the EPA. And I seem to have lost my connection to my slides because I went to a website. So let me back up here a little bit and try and get us back on track, because there is one other thing I want to show you here. And that's I'm going to have to stop my share and restart it here. Sorry about this. One little technical glitch. Okay, so in the EPA, the other things they have are best practices guide for improving indoor air quality. And this is handouts on wildfires and indoor air quality in different languages. And the EPA has also worked with states in the US, and many states have gone on their own to develop some very good materials and resources. So here, the state of Montana, for example, has a wildfire smoke response toolkit, one for home and one for school. And these show you what are in these toolkits. There's checklists for clean indoor air, educational resources, and handouts on wildfire smoke on your health, but also for employers and employees. And this slide has a couple of websites that you can also access: the Western States Pediatric Environmental Health Specialty Unit website and the University of California in San Francisco Wildfires and Health Education Hub website have information on wildfire health risks and exposure reduction that's available in several languages. And here is the website that you can go to find out similar information on the air quality in Mexico. And you can see all these little circles represent air quality monitoring centers. And it even shows where wildfires are taking place. And you can get information for your specific location using this website. So that is all that I have to say. So if we have any questions, I'd be happy to deal with those.
Primero quiero felicitarte, Paul, porque nos has dado una cantidad de datos y indicaciones muy completa y dejas muy poco margen al comentario porque lo has cubierto prácticamente todo. Pero quiero comentar que el año pasado, en el 2024, la Médicos Unidos por México, conforme a la Universidad Veracruzana, hicimos 3 eventos, todos ellos dedicados a los impactos de la salud con respecto al cambio climático, al estrés hídrico y la contaminación. Y sacamos conclusiones muy interesantes porque la conclusión final era de que teniendo una vida lo más sana posible, pues nos iba a ir mejor. ¿Y por qué lo digo? Con la pandemia del COVID-19 nos dimos cuenta todo lo que habíamos dejado de hacer, sobre todo en promoción de la salud y en diagnóstico oportuno de enfermedades y su control. Y me refiero que México fue de los países más castigados de mortalidad por COVID por las comorbilidades, o sea, obesidad, hipertensión, diabetes, etcétera. Pero esa historia de esos adultos que murieron, pues se escribió realmente en la infancia. ¿Qué fue lo que falló? Pues lo que falló es que tenemos una actividad diferente, una serie de influencias en la nutrición diferentes, y nos abocamos mucho a que México es posiblemente de los primeros consumidores de bebidas azucaradas en el mundo. La cantidad de agua que se utiliza para producir una bebida azucarada es impresionante. Y si tomamos en cuenta que menos del 1% del agua total del planeta es potable, pues estamos desperdiciando mal nuestros recursos. Y además nos afecta en la salud. Lanzamos entonces un hashtag, una propuesta de decir, yo solo tomo agua. Y la Universidad Veracruzana la hizo suya promoviendo de solo tomar agua. Se pusieron bebederos con agua pura donde se llenan los recipientes de los jóvenes y tratamos también de evitar los plásticos de un solo uso porque son los que más contaminan y los que más nos afectan. Y entonces hicimos una campaña dentro de eso, y dentro de las cosas que aprendimos también son cosas que hemos dejado de comer y que con el COVID también aprendimos mucho con respecto a las respuestas inflamatorias. Y me lo digo específicamente con la vitamina D. Los cambios de dieta que se han llevado pues han hecho deficientes a la gente de vitamina D, de zinc y otros micronutrientes, y entre ellos hemos hecho algunas pruebas muy específicas de algunos efectos naturales antiinflamatorios que incluso han hecho cosas interesantes, no solamente en las alergias o procesos inflamatorios, sino también en el cáncer. porque aunque no es el motivo de la plática, también el cáncer se ha incrementado por cuestión de la contaminación. Entonces, lanzamos esa propuesta de yo solo tomo agua. Al decir yo solo tomo agua, cuidamos el planeta, conservamos mejor nuestros recursos, el organismo funciona mejor, prevenimos enfermedades derivadas por el consumo de azúcares y que dañan además los riñones, los pulmones, etcétera, y disminuimos los riesgos de obesidad, que es un proceso inflamatorio también, y que la obesidad por sí mismo también da respuestas inflamatorias más exageradas en el caso de los asmáticos. Y entonces lanzamos esa propuesta con la intención de que todos digamos, yo solo tomo agua, un efecto dominó, una influencia con las diferentes generaciones, y hemos propuesto también dentro de las cosas que hemos visto, porque desgraciadamente en México tenemos más de 170 escuelas de medicina y todas las escuelas de medicina enseñan como quieren, le dedican determinadas horas a determinadas materias. No hay una manera de evaluación la calidad de la educación, de la enseñanza-aprendizaje. Hace 16 años publicamos un trabajo acerca de la enseñanza-aprendizaje de la pediatría en el pregrado, en el posgrado y en la educación médica continua. Y propusimos un decálogo de propuestas. Te voy a hacer llegar la referencia con mucho gusto. Y pues vemos tristemente que hemos avanzado poco y mucho menos se enseña pues las nuevas herramientas, ahora ya un poco más de inteligencia artificial, la utilización de la web, seguramente en el futuro ya aplicaciones del CRISPR y cosas así en edición de genes, pero se nos está olvidando lo más elemental. ¿Cómo vamos a promover una buena alimentación, el hacer ejercicio y lo que es el concepto actual de la salud, que es la capacidad de adaptarse a las situaciones cambiantes con el estrés, la angustia, el manejo de las emociones y toda esta serie de cosas? Y parece que estuviera cada uno en esos temas esparcido, pero no, están involucrados todos porque al aumentar la temperatura la gente se pone nerviosa, se pone ansiosa, aumentan los choques, se ponen de mal humor y eso también afecta a la salud, afecta a la respiración y las respuestas humorales. Entonces creo que hablamos también de una investigación que se hizo acerca de los pañales desechables y me parece impresionante cuando se llegaron a las conclusiones de la cantidad de toneladas que se producen y se manejan mal esas toneladas de pañales desechables que también contaminan y también forman parte del cambio climático. Eh, Creo que hay mucho, a mí me ha inspirado mucho esta plática y yo quisiera, en lo que mencionaste de los panfletos y acerca de las recomendaciones de procurar áreas verdes y todo, en noviembre próximo vamos a tener un simposio de 3 días que le pusimos un título que es muy agudo porque a partir de eso se hace todo. O sea, y se llama crianza por propósito. Aquí atrás está la publicidad. Y, y eso quiere decir que va a depender dónde naces, quién es tu familia, cuáles son sus costumbres, cuál es su nivel socioeconómico y cultural para más o menos tener una idea cómo te va a ir en la vida. Entonces, queremos, de alguna manera, empezando por la información, de darle la oportunidad a todos aquellos que tienen menos ventajas a que emparejen un poco, se rompa el círculo y se logren lo que nosotros llamamos liderazgo. El liderazgo es que tú seas capaz de tomar las decisiones por ti, lo que a ti te parezca y tengas un objetivo en la vida. ¿Y eso dónde se escribe? ¿Cómo se hace? Hay que crear generaciones nuevas de niños que desde que nace tengan una mamá que cuide su dieta, que desee tener un hijo, que lo cuide, etcétera, y seguramente le va a ir mejor. En estos tiempos de guerras, acá en México, de masacres, de gente que corta en pedazos a alguien, lo primero que pienso es, ¿qué, ¿qué habrá vivido esa persona que es capaz de hacer eso en su casa? en su crianza. Y aunque parece un poco diferente al tema, pues en realidad se enlaza porque desgraciadamente en muchas partes del mundo se sigue cocinando con carbón. Se siguen consumiendo recursos naturales, ¿verdad? De manera desordenada, porque hemos llegado ya a 9.000 millones de seres humanos. Si lo ponemos en el estrés hídrico, consumimos 2 litros diarios, necesitamos diariamente 18.000 millones de litros de agua nada más para mantenernos vivos. ¿De dónde van a salir si 3 de cada 5 niños no tienen agua potable? Entonces, todo eso es importante porque uno decía, la arena del desierto del Sahara. No, pues llega acá. El incendio que hubo en Los Ángeles, en Estados Unidos, no, nos va a afectar. En realidad, todo nos afecta. Entonces, yo quisiera
Yeah.
pedirte a manera de reflexión de tu plática tan bonita, tan excelente, tan completa, tan científica, ¿qué recomendación o cuál sería tu mensaje para la gente que va a ver este video? De decir, bueno, el doctor Paul Williams nos deja de mensaje esto de su plática. ¿Cómo podemos cuidar a nuestro planeta para que en un futuro no nos quedemos sin aliento y podamos respirar?
And thank you. And all of those are great examples of what we talked about was mitigation when you can and adaptation if you can't totally mitigate. I think I go back to my objectives that I talked about at the very beginning of the talk. And it's important to understand what these pollutants are, the importance of air pollutants and health, be able to recognize the vulnerable populations so you can identify at-risk patients and advocate for change to try and educate people about it, educate caregivers and children, as you mentioned, but also try and reduce our reliance on fossil fuels and try and find alternative forms of energy for the entire planet. And as I mentioned, the burden is mostly not from the poor or underdeveloped countries that are producing the carbon dioxide. It's the more developed countries that are doing that. So it's important to focus on those. And then just again, advocates and identification and education.
Definitivamente, y tienes toda la razón. Yo quisiera agregar nada más que en el caso de México necesitamos hacer más investigación. Desgraciadamente, el 80% de la investigación que se hace es informal, o sea, no se llega a publicar. Y es una tristeza que haya tan pocas revistas en México y tan pocos artículos publicados. Nosotros mismos, digo nosotros, mi grupo de gente, a veces tenemos que publicar en revistas europeas o en revistas fuera de México. Eh, Otra de las cosas es que no hay apoyos a la investigación. Y creo que tenemos que hacer mucho, 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 porque así como en Estados Unidos es un país como un mosaico, no es el mismo Estados Unidos en el norte, en el centro, en la costa oeste, en la este, etcétera. Igual México. El México no es lo mismo, el México del norte, el del sur, el del Golfo de México, el del Océano Pacífico. Somos diferentes en todo. Entonces necesitamos soluciones que se adapten a nuestras condiciones de forma de vivir, de dinámica del hábitat. Aquí en la zona del Sotavento, la zona del Golfo de México, pues sabemos cuándo van a venir los problemas respiratorios y cómo se van a comportar y cómo son los cambios de presiones barométricas, etcétera, que cambian en horas. Entonces, todo eso lo sabemos. El problema es que lo que funciona bien en una parte, en España, por ejemplo, en Andalucía, o lo que funciona en Ciudad del Cabo, o algo, ¿cómo lo podemos adaptar a nuestras condiciones de capacidades, a nuestras condiciones de atención? Y llego a la conclusión de que necesitamos garantizar pues a la gente para que tenga acceso a la salud, acceso a la información y también haya programas de difusión e investigación para lograr mejores cosas. No sé si tú quieras agregar algo antes de que cerremos la transmisión.
No, I think you've done a great job of outlining the problem. You need to really identify solutions in other places and try and apply them to your location when it fits. And we have to work together in a global fashion and not so much as individual countries.
Quiero reconocer que la Academia Americana de Pediatría tuvo a bien, con Maurice Lagui y Sandy Chong, participar con nosotros en los últimos 4 años atrás. Desgraciadamente ahora perdimos el contacto con la Academia Americana de Pediatría, pero nos encantaría hacer algunos foros de conversatorios, oír opiniones, compararlas, oír sugerencias como una lluvia de ideas y de ahí, pues yo creo que todo eso suma, enriquece la diferencia de opiniones y no solamente quedarnos con una opinión. Ojalá que retomemos esa relación con la Academia Americana de Pediatría, también por supuesto con la Academia Americana de Alergia e Inmunología, nos encantaría, y que en los próximos eventos que tengamos por parte de la Fraternidad Médica por la Salud, Médicos Unidos por México y el Colegio de Médicos del Estado de Veracruz estén vinculados junto con la Universidad del Valle de México, la Universidad Veracruzana, y creo que se pueden hacer cosas muy, muy interesantes enriqueciéndonos de esa manera. Quiero agradecer a nombre de la Fraternidad Médica por la Salud, del Colegio de Médicos del Estado de Veracruz, la excelente conferencia del doctor Paul Williams y agradecer a los que se unieron a la plataforma de Zoom, a la de Facebook, y este video estará en unos minutos en nuestro canal de YouTube. Muchas gracias a todos, buenas noches y hasta pronto.